Hi guys, my name is Becky Taylor. For my article, I chose it from US Week. It was written in January of this year. So to summarize the article, it talks about how that the opioid crisis is getting worse. The death toll was 5 times higher in 2017 than it was in 1999. So we've seen a significant increase in deaths over the past few decades. It estimates there are currently 2 million Americans that are currently addicted to opioids. The article also talks about how difficult that it can be for addicts to receive treatment sometimes. Some of the barriers that the opioid addicts might face are that there are long waiting lists to get into some of the inpatient treatment clinics. Also, some of the different states' Medicaid programs do not cover the treatment options that are out there. Some of the treatment options that the article talks about are the Suboxone and methadone clinics. It also mentions about how important that counseling is. The article talks about how that it's important to counsel for the cause of the addiction. Some of the common causes that people sometimes get addicted to opioids for are mental health issues, maybe childhood trauma, social and economic decline as well. The article also talks about what is being done on a state and federal level to try to combat the opioid crisis. In 2016, there was a policy called the 21st Century Cures Act of 2016. It was a policy which allocated $1 billion in grants for the education and prevention of opioid abuse. Also in October of this past year, President Trump signed into legislation to promote access to treatment, and he also limited the amount of fentanyl that could be shipped through our U.S. mail system. For my alternative pain therapy relief, I chose aromatherapy. I feel like it is an inexpensive alternative pain therapy, and I feel it's easily accessible and very easy to use. There has been significant research over the last few years pertaining to aromatherapy. There's all kinds of peer-reviewed articles out there about it. I think that it can decrease opioid dependency just because it is something that requires little effort from a patient standpoint to do. And I believe most patients, because it is so easy to use and because it is fairly inexpensive, I believe they would be willing to at least try it. I think it would be culturally acceptable in our area because a lot of people already currently use candles and other air fresheners for scents in their home. So why not use essential oils for medicinal purposes? The targeted audience that I submitted for my teaching plan was on a progressive acute care floor, and most of them are suffering from acute and chronic pain. Some of the acute pain sufferers is a result of inflammation, injury, or other disease process. And some of the chronic pain is caused from arthritis, fibromyalgia, cancer, or previous trauma or injuries. I would estimate that probably less than 10% have tried any alternative treatments to pain relief other than the opioids or NSAIDs. For my teaching plan, my overall goal is that the patient will be able to verbalize how to use aromatherapy and what essential oils are derived, where and what essential oils are derived from. For the learning objectives, I'm going to go over those next under each domain. Under the cognitive domain, I put that the patient will be able to list 3 different types of essential oils that are commonly used in aromatherapy. I also put that they would be able to describe the various methods that aromatherapy can be delivered to the body. Under effective, I put that the patient will be receptive and to the information that is presented, and they will be willing to participate in aromatherapy. For psychomotor, Learning objective, I listed that the patient would independently perform Google searches to seek out more information related to aromatherapy. Under my evaluation techniques to know if learning has occurred, for cognitive, I put learning will have occurred if the patient is able to explain what aromatherapy is. Under the affective domain, I put the patient will accept the information and that they are willing to share any concerns or barriers to using aromatherapy. Under psychomotor, I put that learning will have occurred if the patient schedules an appointment with a aromatherapist or seeks out additional information from their healthcare provider. So this is my teaching handout that I'm going to submit on aromatherapy. Let me move it to this side here. So I'm going to go over this with you guys. Aromatherapy uses essential oils, which are highly concentrated substances extracted from flowers, leaves, stalks, fruits, and roots. Aromatherapy may help to relieve symptoms of pain. Some common pain that aromatherapy may help to relieve is arthritis, migraines, back pain, menstrual pain, cancer pain, and other pain ailments. Some common essential oils that are used in aromatherapy are Roman camel, rosemary, clover, peppermint, lavender, clary sage. The clary sage can be used for menstrual cramps. Peppermint can be used for arthritis. Lavender is a lot of times used for headaches, and there are many other essential oils out there that are used for pain relief. So aromatherapy works by that it stimulates smell receptors in your nose that sends a message to the area of your brain that controls emotion and memory for pain. And these essential oils have various scents that can be delivered to the body. They can be delivered to the body by a massage through the skin. So when you apply it to your skin and then massage it into your skin, they can be delivered through a humidifier or through a diffuser. A humidifier or the diffuser can be purchased from Walmart for as little as $14. Most of the bottles are the cheapest bottle is usually about $8 for a 4-ounce bottle of the essential oils. You can purchase them online. You can purchase them at Walmart, Amazon, Walgreens. They're very easily accessible. Some things that you want to keep in mind also is that less is more when you're using the essential oils to put into a diffuser or a humidifier. A good general rule is that you want to maybe put 1 drop per ounce of water in your humidifier or diffuser. You also want to keep in mind that if you have a smaller room that you may not want to use as much. Some common signs or symptoms that you might have used too many drops in your diffuser would be that if you get a headache, if you feel nauseous, or if you feel dizzy at all, then you might want to next time decrease the amount of drops that you put in your diffuser. You can also, if you don't want to use a diffuser, you can even just put some drops, 2 or 3 drops on a cotton ball of essential oil, and you could just sniff it and then save the cotton ball for later in a Ziploc bag. You can also put it in a spray bottle and mist it into the air in the room if you would like. Some other things to keep in mind when using aromatherapy is that before you use it, you want to definitely talk to your healthcare provider to make sure that it's okay. Some types of essential oils can interfere with maybe current medications that you're taking, so be sure to check with your healthcare provider. You don't want to swallow essential oils. Also, if you have sensitive skin, it could cause an allergic reaction to your skin, so you want to keep that in mind. Another important thing is to consider if you have any kind of breathing problems such as asthma, emphysema, COPD, then aromatherapy may not be for you because it may cause you to have more breathing problems. You want to keep the essential oils out of reach of children But most importantly, I want to reiterate again that you want to talk to your healthcare provider to seek out more information, and ask your healthcare provider to refer you to aromatherapist. You can also Google information online about aromatherapy. There's all kinds of information out there readily available. Thank you.